My name is Amy Dobberfuhl. I am a urologist from the United States. I practice at Stanford University. Our presentation is titled Pilot Prospective Assessment of a Novel Patient-Reported Pain Questionnaire During Cystoscopic Intradetrusor Injection of onabotulinumtoxinA under Local Anesthesia. Source of funding is the SUFU Foundation study of chemodenervation. Background and aims. Intradetrusor botulinumtoxinA chemodenervation injection via cystoscopy is FDA approved for third-line treatment of overactive bladder. The office setting using intravesical lidocaine instillation avoids the risks of anesthesia, reduces patient time burden, avoids operating room costs, and improves physician productivity. However, pain reported during botulinum injection in the office setting has not been fully reported in the literature. Our aim was to compare patient-reported pain without general anesthesia during cystoscopy with and without botulinum injection in the office setting using a novel pain questionnaire. Our methods. IRB approval was obtained for investigating a prospective 4-question pain questionnaire administered immediately following routine cystoscopy with and without botulinum injection from November 2018 to June 2019. All procedures were performed by a single physician, and patients received lidocaine intravesical analgesia prior to instrumentation, which was instilled for 5 to 10 minutes dwell time. Patients undergoing botulinum injection received 10 to 20 injections in the posterior lateral walls, with or without sparing of the trigone. Within 1 minute following completion of the procedure, patients were asked to fill out the questionnaire. Patient demographic, comorbidity, and procedure characteristics were recorded. Data are presented for mean, standard deviation, and student t-tests. Methods. Questions on this questionnaire, seen in Figure 1, determine the following. Degree of discomfort or pain on a 10-point Likert numerical rating face grimace scale. Number 2, the part of the procedure that was most uncomfortable. Number 3, the need to terminate the procedure due to discomfort. Number 4, if the patient would be willing to undergo the same procedure again if beneficial. Results. There were 40 cystoscopy procedures with questionnaires completed during the study period. Patients who underwent cystoscopy with ureter stent removal or urethral dilation were excluded. For the remaining 35 procedures, data is shown in Table 1. Cystoscopy alone was performed for hematuria in 16, obstructive symptoms in 6, and recurrent urinary tract infection in 7 patients. 6 patients underwent botulinum injection for refractory overactive bladder. We found no difference in overall pain on the Likert scale, and for both procedures the pain levels were mild. The phase of the procedure which patients reported as the most uncomfortable during cystoscopy alone included entry of the cystoscope, cystoscopic inspection of the bladder, and not relevant, with entry as the most painful portion. During botulinum injection, entry of the cystoscope was most painful in only 1 patient, with 2 out of 10 pain reported on the Likert scale. The remaining 83% reported that injection was the most painful part of the procedure. No procedures were stopped early due to discomfort. All patients in each group reported if the procedure was beneficial, they would undergo the same procedure again. Discussion. There is no difference in pain scores for patients undergoing cystoscopy alone compared to cystoscopy with botulinum injection, and overall the pain was mild based on a Likert score of 2 to 3. This suggests that pain of the procedure is primarily associated with insertion of the cystoscope, even though the patients who had botulinum injection did indicate that the injections were more painful than insertion of the cystoscope. This was a small pilot study and should be repeated with a larger number of patients. The utility of the questionnaire shows promise. Therefore should be further validated. Conclusions. Future research on pain during botulinum injection should be directed at identifying pain during different sites of injection. For instance, the trigone, posterior wall, lateral walls, as well as alternative routes of injection, which may compare cystoscopic versus transvaginal routes of administration. Thank you.